Labour government showed that in the so-called opposition, they were not willing or capable to challenge the most egregious attacks on our democracy. And they would far prefer a globalised response. It means that often, like many of the elected representatives, they don't have to take responsibility when they say, well, this is what they say somewhere else, this big international global organisation, we've all got to do it, we've got to keep you safe. You talked about it. The United Nations and the World Health Organization is not what it once was. Member states have far less interest in there, and a few have dominated it over the last few years. The idea that Tedros will be keeping us safe is preposterous. But I think there's a really crucial thing here, Kevin, which is that the international health regulations and the amendments, on the one hand, you've got a situation where it does depend who's doing the dealing with them. But like we've seen with the civil service, and the public sector, even when the government wants to do something and says it's going to do something, you've got people that are actually back channeling and campaigning against them to stop them doing it. Even when they've got a mandate to do something like around the borders, you've got a situation where they can't get it over the line quite often. It's very anti-democratic. So we've got that concern. But at the same time, we've got the problem that it was actually us here. It was our elected representatives after the whole Brexit experience, saying we're going to have autonomy and sovereignty and freedom. They then locked us down. Now, it's true that other nations all did that, but it was using the Public Health Act, which needs to be amended radically. Francis Hoare, who's the head of our cabinet on law, has talked about this and written about it, and he's got a case going on about it. So we're very keen on making sure that the British public holds the feet of elected representatives to the fire and say, we must retain our sovereignty. The idea that we have diktats coming from abroad about what we should and should not do have to go out the window. But equally, we need to make sure that what's happened before, the fear, the nudge, the impositions, we do a calm, rational, calm assessment of anything. We have a pandemic preparedness strategy, and we do not allow the disposal of our freedoms and liberties. We do not allow lockdowns again. And we make sure that we assert ourselves. That's why we organised this together, the association. That's why I'd invite everyone to get involved with us, to make sure we keep them honest.
Yeah, that was what I said that in my monologue. I said, look, this is encouraging that at least our current government says we're not going to sign this grotesque globalist contract. We're not going to sign it. We're going to make our own decisions. Thank God for that. But then I added, so far so good. But now, how about a firm commitment never to lock this country down again? As we discussed the other night, there's no evidence they worked. There's a lot of evidence that they didn't work. They didn't contain the disease. They didn't contain the virus because it kept coming back as soon as we unlocked, and they inflicted on this country untold social and economic damage. So I would like to hear the government say we won't go down that road again. What chance do you think there is of that, Alan?
Well, we just had Jeremy Hunt saying he's not going to change interest rates, saying at some point the illusion that inflation is going to go down, it must happen, we hope it happens. The reason, when you print enormous amounts of money and give it out and you shut the economy down for a period of time, and what do you expect to happen? You create a situation that we now are dealing with the consequences of. And I think it's really, really important. I mean, no one really wants to talk about this. It was a grotesque period. When you look back at the videos and the things, people are like, wow, it was all dystopian. But the idea was that it was going to be a once in a lifetime, keep people safe. And now we've seen through the lockdown files, the Twitter files, the spying, the censorship, the lying. We've seen that was not the case. And so there's a trust deficit. But it's really important that the public assert ourselves, that we have our voices heard, that we make sure MPs, those who are standing in the next election, hear from us to say never lockdowns. We're going to vote on you on this basis. Mm-hmm. Will you sign a pledge to say we're not going to have lockdowns again, and that with anything that we do, we have an assessment of the risk and the rewards, a cost-benefit assessment, and that they'll be accountable. And this is something that in the end, if a significant amount of the public do, like we've had other legislation change now around LTNs, around Liverpool streets, and a whole range of issues around net zero. If people assert themselves and have their voices heard, we can have an impact. They're very nervous about the elections. They all want our votes. Some people are standing independently. It's a very exciting time, a slightly daunting time. This is an opportunity to make sure that the public's interests and true health, because all those people that had cancer and strokes and heart disease All those people were neglected, as well as our elderly, as well as our young, under this folly. So it's an opportunity. So people should get involved with togetherdeclaration.org. We love to have you involved. We've got groups around the country, and make sure we have our voices heard. So we need new representation, a mixture actually of people, the old red wall people, and people with different ideas, left, right, centre, who have come around these issues of democracy and freedom and the public first. I think the thing that's essential is, look, there's an important discussion, and it still hasn't been had openly and honestly, about the efficacy of vaccinations and jabs, how much benefit they brought to the people that really needed it. And this is a crucial question. Who were the most at risk, and to what extent did it stop it? Did it stop transmission? Did it ameliorate? Penny Mordaunt as well, calling people conspiracists today for challenging, raising these issues. So there's always side effects. But the thing is, there are side effects with various medications, but we know that this was taken off by some countries before. And we also have to do an assessment. Is this being given to everybody in the population a sensible move? Is it just for the most vulnerable, or should it be for no one? And knowing the side effects and the impacts, and it's not just deaths, it's side effects, as you've said, what is the versus the risk of what could happen with COVID tube? What is the context of that? And an honest assessment of excess deaths for the last 10 years, and an evaluation of, we couldn't do post-mortems, that horse has bolted now, right? But a proper evaluation that we're honest. That's what science is. Mm-hmm. Science isn't a political policy. Science is an honest interrogation and the pursuit for evidence and the truth, and to have theories about what works, and you test them out and you explore, and it's experimental. Political policies based on what we should do are based on discussions and judgment. And there's been huge dishonesty, and there's been there's no wonder so many people did not come out and vote in the last elections, and we'll see what's going to happen with the next one. But it's important that we don't allow the lack of trust. Well, also, Kevin, so many things not said. The majority of people that were dying were a lot of old people in care homes that were brutally treated. No ring of steel, Matt Hancock's lie. And that's where we saw the majority of deaths, the vulnerable and the elderly, which we knew would happen. But remember what so many people said, not just politicians, but those in the media who became tub-thumping cheerleaders. They weren't interrogative journalists. We had vaccine passports. We had a mandate imposed. We had people being terrified and told that they wouldn't be able to go certain places. You have to wear badges. It was absolutely ludicrous and very terrifying. And this is the problem, right? You set up a situation where you can start, in the last couple of days, we've seen all the videos coming out again of how people are saying, well, it's 100% all safe. These people are making this stuff up. The thing about if we're going to make sure that people have some confidence in science and the medical establishment, we've got to have robust, open discussion. The same with our political democracy. We've got all sorts of issues. We've got all sorts of ideas at the moment. We can't shut them down. We've got to be able to debate them with fellow citizens, treat each other with democratic respect and exercise our judgment. And we've got to be able to have a situation where we don't just prorogue Parliament, we don't shut things down and then call people names and spy on them we don't agree. None of that is the behaviour of people who know they've got the authority and are doing the right thing for the public. That is the behaviour of cowards, it's the behaviour of liars. And unfortunately, we've seen far too much of that. And Britain's crying out for some new blood.